Hello, it's Dr. Rhonda Johnson. Today is Friday, May 5th, 2023. Well, COVID has been in the news today. You probably heard that the World Health Organization ended the COVID-19 global health emergency today, saying it was time for countries to transition from treating COVID as an emergency to dealing with it as a disease that's here to stay. The World Health Director, Dr. Tedros, noted that the pandemic isn't over and the threat that the virus causes remains. He did acknowledge that millions have died during this pandemic and millions are debilitated from long COVID around the world. And he said that the virus is still killing and it's still changing. And the worst thing that any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about. So that's the update on the World Health Organization. I want to move to now important news from the Centers for Disease Control and Prevention here in the U.S. Well, you probably heard too that CDC Director Dr. Rochelle Walensky announced her resignation today. Her last day as CDC Director is June 30th. I personally think she's done a good job. Now, the Centers for Disease Control and Prevention also plans to scale back the data that the agency will report on regularly about COVID-19. One of the biggest changes, it's no longer going to regularly track and report on the number of new COVID cases. And that makes sense because states will no longer be required to report new cases. In addition, home testing, which isn't reported to authorities, has made case data unreliable. Now, the agency is going to report on hospitalization data only. And what they'll say is that levels of COVID-19 hospital admission rates are low, medium, or high. They're doing away with community level reporting, and they will continue to do wastewater monitoring for the virus at the wastewater testing sites across the United States, and they're going to monitor for international flights arriving in the United States, the airplane wastewater. Now, what do you think about that? What do you think about the World Health Organization and the CDC news? As I mentioned, I think that Rochelle Walensky has done a good job. I think it's very difficult to run an agency like the CDC in these political times. And I knew the public health emergency was going to have to end anyway from the World Health Organization, so that's no surprise to me. That's my thoughts. Be sure to share yours. Take care, folks. Be safe.